The next speech is paper ID 433, titled Automated Surgical Workflow Identification by Artificial Intelligence in Laparoscopic Hepatectomy. Dr. Kimimasa Sasaki is a HPV surgeon of National Cancer Center East Japan. His specialty is deep learning and machine learning in HPV surgery. Okay, Dr. Kimimasa.
Yes, hello. Can you hear my voice?
Yes.
Yes. I'll show you my PowerPoint.
Yeah.
And can you see my presentation?
No. Okay. Okay, I
Okay.
just see your slide.
Okay, today I'm going to talk about automated surgical workflow identification by artificial intelligence in pure laparoscopic hepatectomy. Here we have introduction as potential benefits of laparoscopic hepatectomy. We say LH. LH reduces intraoperative blood loss, transfusion rate, post-operative morbidity, length of stay, and post-operative pain. However, LH is offered only at the referral centers with technical difficulties and the necessity for experience in both hepatobiliary and complex laparoscopic surgery, hampering its widespread adoption. So far, preoperative system of computer-assisted surgery that we call CAS, such as 3D simulation or CT volumetry, has been widely used in daily clinical practice. However, development of new intraoperative system of CAS are expected to guide LH. We expect that intraoperative CAS system may help to standardize and to spread safer procedure of LH. To our knowledge, studies describing automated surgical workflow identification system focused on LH are lacking. Therefore, this study aims to develop a deep learning model for automated surgical workflow identification in LH. Here we have a material and methods. About the data set, we made a data set of 40 cases of pure laparoscopic hepatectomy in National Cancer Center Hospital East in Kashiwa, Japan, from July 2018 to 2019. And we divided this video to train data for 30 cases and test data for 10 cases. The video data was divided into 30 frames per every second as static images, which were manually divided into 9 surgical steps. Here we have the 9 surgical steps in laparoscopic hepatectomy. This is the scene of extracorporeal action, and number 1 is port insertion, and 2 is lysis of adhesion. And number number 3 is identifying the lesion of laparoscopic ultrasound and marking the resection line, and 4 is encircling of the hepatoduodenal ligament and hepatic inflow occlusion. 5 is mobilization of the liver, and 6 is liver transaction, and 7 is piston extraction and closing of the surgical incision. 8 is other action. We have the picture of each surgical step here. And about the machine deep learning, the exception model was used as the convolutional neural network architecture and was pre-trained using the ImageNet dataset. A deep learning approach was used to classify individual video frames as one of the pre-learned set of steps. Automated identification of 8 steps was performed after step 0. This is extracorporeal actions were excluded from the video. We call this model as a model 1. And moreover, step 1 and step 7 and step 8 were compiled as step invalid procedure to efficiently identify the surgical step and automated identification of 6 steps was performed. We call this model 2. Step invalid procedure includes procedures that do not directly make the progress of the operation. The video frames in this step have similar visual features. Here we have about evaluation metrics. We use the F1 score of each class and overall accuracy for all classes as evaluation metrics. Here we have the results of the data set. Almost all of the video was we have the disease of colorectal liver metastasis and hepatocellular carcinoma and intrahepatic cholangiocarcinoma. And about the length of the video, we have the operation time here, and the median time was 123 minutes. Here this slide shows the duration of each surgical step, and there were more than 8 million frames in the data, comparing the 40 per LH cases. The longest step was step 6. It's a liver transaction, and shortest step was step 2. This is the light of adhesion. And this slide shows the results of the evaluation metrics. The model 1 of our was the overall accuracy was 0.891, and about model 2, the overall accuracy was 0.937. This is a representative case of model 1, and this is the ground truth of model 1 of the video, and this is a step identification result of model 1. And this part, the model 1 mistakes the step 7 as step 8 or step 6, and this is a more better model 2. This is the ground truth of the model, and this is a step identification result. Model 2 has a better recognition of this part. This is a video of real-time surgical step identification, and this is this part is a real-time prediction of surgical steps, and this is a video of the hepatectomy, laparoscopic hepatectomy. I'll show you the video. This is a scene of port incision, and almost all. And this is a mobilization of the liver, and this is a liver transaction model. Our model can recognize the surgical steps correctly. The deep learning model performed automated surgical step identification in real time at the 21 frames per second on average. This is also the scene of the liver transaction. AI correctly recognized the surgical steps. Here we have the discussion of the study. This study describes the use of AI with deep learning for identifying the surgical steps in 40 pure LH cases based on manually annotated data. To the best of our knowledge, this is the first study in which deep learning approach was applied to a video of dataset of LH cases. About the accuracy of our model, Our deep learning model achieved higher overall accuracy of automated surgical step identification than that of other studies. We consider there are mainly two reasons for this. One is the compiling three steps as a step IP, and second is mechanism of computer vision techniques. First, step IP is composed of step 1, step 7, step 8. These steps include the procedure do not directly make the progress of the operation. Additionally, the video frames in these steps have similar visual features. And we succeed to develop not only high create deep learning model, but also the models that effectively identify the essential surgical part of LH. And second, deep learning model automatically learns the video feature of every frame in training data. And the model then identifies the surgical step in the test data based on the visual features. In LH, the visual feature of the target structure differ clearly as do the specific instruments used during each surgical step. In contrast, it may be difficult for AI to correctly recognize each surgical step in laparoscopic sigmoidectomy. It's colon surgery, and because colon is naturally difficult to distinguish from rectal, and no characteristic surgical instruments are used during each surgical step. Therefore, we consider that LH may be more suitable for the CAS system than LS and other operations. This slide shows the applying to systems to improve the efficiency and automation of surgery. Our model could help to guide the use of surgical instruments for assistants and surgical teams and estimate the remaining duration of surgery. And this slide shows the system of creative information and focused education material for trainees. Our model automatically understands surgical images, and it could be utilized to help identify specific segments of an operation to help make video review more efficiently. And about development of the interoperative CS system, our model already has identified liver transaction, and the model will be improved in the future to automatically identify bleeding in the parenchymal dissection plane. Our model could contribute to develop interoperative CS system that is effectively arrange operating room logistics and eventually to improve patient safety in LH. Conclusion, we have developed a highly accurate deep learning model for surgical step identification in pure laparoscopic hepatectomy. Our model could be applied to various systems of computer-assisted surgery. Thank you for listening. That's all.
Okay, thanks, Dr. Kimimasa. Are there any questions for Dr. Kimimasa? Okay, thanks, doctor. And we will move on to the next one.